All right, thank you for joining today. For today's Cancer Grace video, we'll have a virtual roundtable discussion to review updates for head and neck cancer care in 2025. It's been an exciting year with many important studies reported. We'll focus on two major congresses, ASCO and ESMO. Today, our panel consists of head and neck cancer medical oncology experts. I'm Sid Sheth and will be moderating today's session. I'm a head and neck medical oncologist from the University of North Carolina. My research focus is in clinical trials, and my translational interest includes identification of novel biomarkers to improve patient selection and monitoring treatment response. It's my pleasure to introduce you to our panelist. First is Dr. Ari Rosenberg, who's a head and neck medical oncologist at the University of Chicago. Dr.
Thanks,
Rosenberg?
Sid. Yeah, thanks, Sid. Great to be here and looking forward to the discussion. So, like Sid said, I'm a head and neck medical oncologist at the University of Chicago. I focus on clinical trials and novel therapies, as well as biomarkers and treatment optimization. So, in other words, how to improve survival for patients with head and neck cancer while reducing some of the side effects associated with treatment or the disease. So, looking forward to the discussion. Thanks.
And second is Dr. John Casmar, who's a head and neck medical oncologist at the Medical University of South Carolina. John?
Yeah, thanks for the introduction, and excited for the stimulating conversation today. As Sid said, I'm a medical oncologist to lead the phase one program, and I too am interested in optimizing therapy, intensifying, so making therapy more aggressive for folks with cancers that are likely to recur, and then de-intensifying or making therapies gentler for patients that we believe we can potentially cure with less than the standard of care.
Well, great. It's so exciting to have both of you on. And it's been a great year for head and neck cancer in 2025. In my opinion, the most important data was in the perioperative setting. Two large randomized trials evaluated immunotherapy in the curative intent setting for patients who were receiving surgery. The first trial, Keynote 689, evaluated pembrolizumab, which is an anti-PD-L1 inhibitor, before and after surgery in patients with locally advanced head and neck squamous cell carcinoma. In the Cortec trial, nivolumab, which is another anti-PD-1 inhibitor, was given to patients who have high-risk disease following surgery. So first, I want to start off with some definitions. John, we often hear the terms perioperative, neoadjuvant, induction. How do you define these terms to your patients?
Yeah, there's a little bit of a word salad and it can get confusing, and I think probably myself and others are guilty of sometimes misappropriating them. I think perioperative is kind of an umbrella term of treatment around surgery, so it can be before or after or both. So kind of a broad umbrella term. Neoadjuvant we really consider as treatment exclusively before surgery, and induction we generally use when we're talking about some type of treatment prior to, in this case, in head and neck cancer, usually a definitive chemoradiotherapy or radiotherapy.
Great, man. And Ari, a couple more definitions to discuss. How do you define locally advanced disease? And also following surgery, what defines a high-risk patient population?
Yeah, thanks, Sid. So, locally advanced disease is actually how we initially see the majority of our patients with head and neck cancer. Generally, it means that the tumor has either reached a certain size or invaded surrounding structures to reach a certain threshold, depending on the size, or that the disease has spread to lymph nodes in the neck. And so the reason why this is an important distinction is because generally it implies that the treatment is going to have multiple modalities as part of it. In other words, multiple different tools from our toolbox to use to treat that, whether it's some combination of surgery, radiation, chemotherapy, or now more recently, immunotherapy, as I'm sure we'll discuss. And that's a little bit different than very early stage disease or very advanced disease, which isn't necessarily treated with the intent to cure.